Hello, I think we're on and ready to go. Hello, I'm Tom McCool. I will be your host today. And this is the last of 4 sessions of a special panel series for United Way Vanguards. So in the previous 3 sessions, we have discussed the current needs of our community as a result of the global pandemic that we're all in. In each session, we brought in experts from our local community to talk about the effects of this pandemic, the needs of Greater Lafayette. Today, we have leaders from government, from the sheriff's office and our public school system to talk about how the city and county is responding to the pandemic. And I'd like to introduce them to you now. First, I'd like to introduce Dr. Alicia Clevenger. Alicia, like to tell us a little bit about yourself?
Sure. Thank you, Tom. I'm Alicia Clevenger. I'm the Assistant Superintendent at Lafayette School Corporation. I oversee elementary curriculum and instruction. I'm in my 26th year of public education and in my 10th, or actually 12th year of administration. You kind of forget after a while. But I'm happy to be here today. I also have some experience with Tippecanoe School Corporation previously before coming to LSC. So been in the community for quite some time. Happy to be here today. Thanks.
Great. Next is Sheriff Bob Goldsmith. Sheriff Goldsmith.
Yeah, well, I'm Sheriff Bob Goldsmith. I'm the Sheriff of Tippecanoe County. I've been in law enforcement for 23 years. I'm finishing up my 19th year here at the Sheriff's Department. I've been in administration now for going on 6 years. Born and raised in Lafayette, Indiana, and like Dr. Clevenger, I oversee all of this. So thank you for having me.
Great. Thank you, Sheriff. Next, Tippecanoe County Commissioner Tom Murtaugh.
Thank you, Tom, and thank you to the United Way for hosting this panel series. It's been very informative the past few weeks. Yes, I'm Tom Murtaugh. I'm Tippecanoe County Commissioner. I've been a county commissioner for 12 years, and prior to my political life, I worked in banking here in town, and like the sheriff, I was born and raised right here in Tippecanoe County, and obviously this community is very important, and appreciate the cooperative spirit of this community, and appreciate all the work that the United Way does in the community.
Great, thank you, Tom. I think first I'd like to probably start with Dr. Clevenger. I think a lot of people are really interested in how this pandemic is affecting our schools and what's been going on there, just as much as it's affected all of our lives. I have a daughter who teaches at Vinton Elementary School, particular interest in that. So, Dr. Clevenger, you kind of make a little bit about how the schools are working on addressing this pandemic.
Right. Thanks. And Katie does a great job for us here in LSC as well. We appreciate all the efforts she does at Vinton. We have been very busy on all of this since prior to the start of school. We were shut down immediately mid-March, and we went to e-learning. And we were open for 3 days, Monday, Wednesday, Friday, did Tuesday, Thursday, waiver days because the state gave us waivers. So we didn't have to go to the mandated 180 days of school. Well, for this school year, there are no waivers. We have to attend 180 days of school, regardless of what that looks like. So, you know, with guidance from our local health department and from the state health department, we developed a reopening plan that we made public probably mid-July or so. And we offer e-learning and we offer in-person. And so we started out the school year about 34% of our students enrolled in LSC K to 12 opting for e-learning, which means that they are at home. They have been assigned an e-learning teacher in K to 6, and from 7 to 12, it's a little bit different because we contract through a third party where they're getting their education from that third party company, and they have a coach that is assigned to them from LSC. So with that said, part of our reopening plan was to give parents and families that the first 10 days of school, that period of adjustment to see if what option they chose was going to work for them. And we did have some families that switched either from e-learning to in-person or vice versa, in-person to e-learning, to make that decision. And we accommodated that. And it shifted some classes. It shifted, students switching from one e-learning teacher to another because we had to collapse some sections, which was difficult. It's difficult to do that. But we certainly wanted to accommodate the reasons why, and those reasons varied from families to families of why they opt for e-learning or for in-person. And so we are about midway through our first 9 weeks, and our first quarter ends October 16th. And at that time, families have another opportunity to switch from e-learning back to in-person. So based on how things are going, we'll see what happens at that point in time. But for those that are in-person, in my conversations with administrators in the buildings, it has gone very, very smoothly for those that have attended in person. The kiddos are wearing their masks. Adults are wearing their masks. I think everybody was just very hesitant in coming back just of the unknowns. And it's gone just much more smoothly than anybody could have anticipated. Our reopening plans, not only district-wide, but each school, because of their layout and their plans, logistically had to make some adjustments so that we could best socially distance in the best way that we can. And schools, by and far, students, staff, support staff are all working together to make this happen. And I really commend our schools, not only in LSC, but whole county-wide. Everybody's doing such a phenomenal job. And it's really, if anything has come out of COVID, it's been a new collaborative working relationship, even within our district and 3 public school corporations. I know our superintendents are communicating on a regular basis about things and what we're doing and how we can share ideas with one another. So it's been challenging, I'm not going to lie, but we're persevering, and we're just going to keep providing that safe environment and educating the kids the best that we can. We've had a lot of support from the state government through the federal government CARES Act funding, where they have provided millions of dollars to school districts to buy PPE, to support teachers who are doing e-learning. We have done professional development with our teachers, because last spring e-learning was not the best it could be. And I think if you ask anybody in education, they would agree with me and say the same thing. So over the summer, we provided a lot of professional development to our teachers, not only who are teaching in person, but those that have been designated as e-learning teachers, so that they can best teach and instruct kids virtually. And I've seen some of this go on, and our e-learning teachers are doing a phenomenal job. So our kids are really fortunate to have hardworking teachers out there that are providing the best instruction that they can.
Yes, I can relate to a lot of what you're saying in my role in Ivy Tech,
right? Because
we have gone through many of the same things. We're trying to keep a low density at our campus. Many of our classes that can be online, like communications or psychology or English, those are all online or virtual classes. So they may be meeting on Zoom, but we have a lot of labs that people have to attend, and they have to get hands-on instruction, so that's been a real challenge. But we have been able to keep a low density on campus. We have staff that are rotating in, working at home part-time, and masks are required in all the buildings. So I really can relate a lot to your challenges there. It's pretty universal among all educational institutions, I believe.
Right.
Well, thank you for sharing that.
Yeah.
Go ahead. Did you have something you wanted to say?
There might be a question about, the e-learning teachers versus in-person teachers, and, how do we select those? And it was, not just one point, we looked at teachers who did an exceptional job last spring and volunteered to do that. We also looked at teachers who might have their own health issues that were really wanting to do e-learning in a more protective environment, whether it's from their home or whether it's in the school building in an area that doesn't have a lot of traffic. And so, we selected teachers by, that if they wanted to do it, by teachers who might have had a health issue, or we picked a teacher who said, you did a really great job last spring and you're very tech savvy and you have this knack of making or developing a rapport with kiddos, even virtually. Would you be interested in doing that? So working with the building level administrators in selecting those teachers with key as well. And again, they're all doing a great job. So our e-learning teachers are working hard every day and continuing to seek professional development so that they become better.
Yeah, that's good. Of course, at Ivy Tech, we have many online classes. So we already had kind of that technology in place and teachers that were able to and was able to use that technology. But I can see how it could be very different in K-12. I think we have a one question on the comments about hearing that is closed in-person school for 2 weeks this Monday. So what's the likelihood that this could happen for Lafayette School Corporation?
Each school district is different. You hear all kinds of different things. I was under the impression that Central Catholic High School only was closed this week due to 2 cases. The situations that I think all schools are facing is the challenge of social distancing. Now, we're at we started about 34% in LS learning, that switch that I described earlier. We're now at about, we're less than 30%. I'd say about 28% that have opted for e-learning at this point. You take out almost a third, a little less than a third of your school, there's not many kids in the building. So, some classrooms have 16, some have 20. So in those classrooms that have fewer kids, you're able to space out and socially distance more. So, we're doing the best that we can. As far as do we think LSC will close or TSC will close? There's really no threshold. There's no magic number of what that would be to make us close. Obviously, again, our 3 superintendents in the public schools in our county are working closely and meeting regularly with Dr. Adler from the health department. And, we seek guidance from them. And if the data tell us that we need to close, that's what we'll do. But in the meantime, we're going to operate as we can, whether it's through e-learning or in person, and we're going to follow all the safety precautions and do the PPE and clean and disinfect and all that stuff that we can to stay open as long as we can, because we know that those that have opted for in-person want their kids to be at school, and we certainly want to provide that environment if we can.
Okay, thank you. Next, I think we'll talk to Tom Murtaugh. Tom, could you talk a little bit about some of the county efforts that have been going on? I know that that probably there's been some real challenges for you, especially in the government area, in providing services. Could you talk a little bit about that?
Sure. Thank you, Tom. Just like virtually every commercial business, every manufacturer out there, we were suddenly hit with making some pretty significant decisions on how we provide government services. Some of those, being essential services. Some of those the sheriff will be talking about. Obviously we've got to operate a jail 24/7, and we have other facilities that have to operate 24/7. Plus, we have to provide, still have to provide basic services to the citizens. Looking back on it, I think it went remarkably well, considering, there were some very, very lengthy meetings and long nights and that type of thing as we were trying to get that moved forward. But, we did essentially shut down our facilities, except for the 24-hour facilities and sent our employees home. Those that could work from home were given equipment so that they could do so. The courts basically set back everything that was on their court calendar. And then the Tuesday after Memorial Day, we essentially brought everybody back. We have a handful of folks who are still working at home due to health concerns or risks. But for the most part, we are back and open, fully functional. But just like everywhere else, we look a little bit different now. And I will have to say too that in some ways we're operating even more efficiently. So it hasn't been a totally bad experience. Now we provide a lot more services online. There's less needs that folks have to take care of in person in our facilities. The courts are set up that they're able to do jury trials, but jury selection, which was typically done in a very small confined room, is now done in the Long Center. And after the jury is selected, then they're brought to the courthouse and then placed in a new social distance jury box. And so things are working smoothly. We've added the temperature stations to our various facilities, including the courthouse and this building, the county building. But our challenges are, again, just offering basic services. A lot of, this is a very, very busy time because our clerk and the election board are in the process of running an election. And obviously, there's a lot of interest in this year's election, and you've probably seen details about that. There's a significant number of voters who've chosen to vote by mail, and so there is a lot of activity around voter registration and actually voting itself. Also, property taxes are going to be coming due in May, so we'll see a lot of activity around that. But we have seen an uptick in folks paying online, and we have seen an uptick in folks actually using the drop box that we have outside. So again, I think the public's been great in adapting. And I'd like to say that things went perfectly in our transition. It did not, but I think we've done well overall in transitioning to a new way of doing things within government.
Okay, Tom, I do have a question. Could you kind of expand a little bit on kind of what election day is going to look like in county, and what people might be able to expect?
Well, it will be, obviously there's going to be in-person voting, and you can actually vote early starting on October 6th. That early voting is limited to just in the county building until the 14th of October, in which you can vote at Mackey Arena. And then starting the day after, or I should say on the 20th of October, then there's various sites that you can vote, and those will be posted. Those are posted on the county's webpage, on the voter registration webpage. And so there will be no Payless sites this particular year because we can't do it, and it's just too cramped for social distancing. So if folks want to vote early, I encourage them to get on the website and find out where they can do that. But again, they can always vote here at the county building during from 8 to 4:30 every day that we're open up until noon the Monday prior to the election.
Great. And also, I know that on election day, Ivy Tech is going to be an election site. So
Exactly.
On that day, you come to Ivy Tech and vote.
Exactly. And also all the polling locations for election day are posted on the internet as well.
Great. Thanks. And next, Sheriff Goldsmith, Tom mentioned something about some efforts at the jail and how you're dealing with that. So I'd love to hear some more about that, Sheriff Goldsmith.
Yeah, and I anticipate a lot of questions and probably getting cut off just because of time. So by all means, feel free to reach out to me. Either call me, send me an email. I answer all my phone calls. I return them. I answer all my emails on my own. So reach out if you have a question, and I will absolutely get back to you. But first of all, as y'all, we can't shut down, so that wasn't an option. So I immediately, and I start off by saying because I believe this starts at the top, and here I'm at the top. So it starts with the attitude of the leadership here. So I came in, I brought the admin in, brought the leaders in, and we came up with a plan very quickly. We got out in front of this. We're months ahead of some of the other departments. But what we did was we decided what areas can we shut down without shutting down completely, and that came down to our lobby. We roped off areas. We allowed one person in at a time because we know that we still have to remain open. We cut down. We eliminated inmate visiting because we couldn't have 20 people in our lobby at a time. For anybody that's never been here, lucky you. If you haven't been here to do any sort of business, our lobby is full a lot. So we had to cut that down. But really it was communication. And when I say that, a lot of people don't understand that the commissioners, this is the commissioners building. So anything we were going to do here, we needed to reach out to the commissioners and let them know and kind of get approval, but to keep them in the loop of what's going on, because if we did something here that maybe the public or staff wasn't approving of, we realized they're going to reach out to the commissioner. So we had to keep them in the loop. And I think everybody should know that county government through all this communicated and worked very well together. Like, in my opinion, like no other time in the history of our county. That's everybody, health department, commissioners, council, everybody worked well together. And that's helped keep it out of our building. We're not naive enough to think this is not going to be in here, but we've kept it out. We over-ordered PPE and cleaning supplies. We outfitted all of our staff with bags with masks and hand sanitizer and gowns and gloves. And I mean, we gave everything to them, and we have a stockpile of it, which is great. Clean daily. We had people, myself included, grabbing rags and wiping off doorknobs every day. Because early on, as Commissioner Murtaugh said, we had to have some people work from home that have never worked from home before. So we had to adapt to that. And it worked out great. We put rotating shifts, so we didn't have people that were in cubicles next to each other here at the same time. We rotated so they were always spaced out. Those areas were cleaned when they were gone. The jail, which is very important. It's our number one responsibility. We cleaned, and we still clean. If you come in here in the morning, it smells like bleach and cleaning solution for hours. But part of that, again, I talk about communication, is communicating with staff. And I went back myself, and Captain Lehman joined me from time to time as he could. But we went back and talked to all the inmates. We stood inside the pod, brought them all out, told them what we were doing. And, some of them agreed, some of them disagreed, but, they had to know what was going on. They live here too. But what we were able to do is work with the judges and the public defender's office and community corrections, which gets left out a lot. Community corrections, Executive Director Huber did a great job working with us to get people out that could be on at-home monitoring, or they didn't need to be in here at that time, and it worked out great. So we're able to lower our population, and I guess I should interrupt myself and say I'm not the one that lets people out of jail. That's not my call. We have to work with the judges. It's a judge's decision, so that's not on me. But what we did is we were able to free up enough space that we have, and they're starting to go away because our population's going back up, which we can hold 603 people. For those that don't know, today it's probably around 550. But we were able to create cells, and I call them Monday through Sunday cells. So if somebody was booked in on a Monday, they were put in a cell on Monday. Their temperatures were taken. They were observed, monitored by our medical staff. They're held there for 14 days. They got breaks. They were on their own. They got to use the phone. But we were able to monitor them. And if they were here past the 14 days, then we could move them back to general population. And that's what I told the folks in general population was, I can assure you that the people coming back here have been up there for 14 days. They've been monitored. They're healthy to a certain degree. I mean, there's people out here that have sicknesses, and we're all aware of that, but they're coming back here and they don't have the symptoms. And I think that helped. We were able to create an overflow area in one of the pods to where when our population's growing up, we could house them there for an extended period of time if we needed to before they could go somewhere else. What we did, we cut down on calls for service that we were going on. And what I mean by that is a lot of times a guy will hear a medical call on the radio and he'll respond because he's close. Well, we weren't responding to those anymore unless it was somebody's life was in danger. And then obviously we would respond. But the stuff like that, we didn't respond to those things anymore. A theft or fraud complaint that we could work over the phone, we worked over the phone. Employees' temperatures were taken when they come in, when they leave. If they feel differently during the day, we took their temperature. We have a kiosk now, thanks to the commissioners, that we were able to put at the employee entrance. So every 10 seconds, I get to hear it say, temperature detected as normal. Please wear a mask. That's kind of a rundown of what we've done, and I'm sure there's more. But fortunately, it's not me. It's a team effort. And if these folks inside here, the 167 employees, don't buy in, this doesn't work. And we end up with this awful virus in our facility, and then we really have a mess. As Commissioner Murtaugh talked about, the courthouse, that kind of took care of itself because it was shut down. But as it opened back up, we had to really supply masks and gloves and things like that to our staff down there and take care of them as much as we could. Protect our staff, protect the public. We're all in this together, and we're trying to do everything we can to keep it out. One other thing we did was I got in with the ISA, which is the Sheriff's Association, and we became early on this happened, and it's since gone away because I think people have adapted, but we took the lead and became a drop-off point for PPE and then distributed that to the other agencies in the area. My thought on the whole thing was, in this area, we are one of the largest facilities, one of the largest sheriff's departments in the area, so we needed to take a lead on this and lead by example and try things. We communicated with the other sheriffs. I talked to them, before all this started on a regular basis, and we started talking a lot more, but helping each other out and working through this to do what we can to keep it out. Let's see here. I see some comments. Is there any mental health incentives enacted recently? Yes. So the mental health stuff that started recently, if we can talk about that, that actually began last year. Quality Correctional is our medical provider in the jail. And we had some conversations about Lisa and myself, the owner of that, of what the inmates would need. And I've been involved in meeting after meeting with all the resources in Tippecanoe County, and we have a lot of them, and they're all doing great work. United Way, thank you for everything. You guys are really instrumental in everything around here and connecting the dots, and it's great to have. But one of the things I noticed in working in the jail for several years, inmates don't have, because of mental health issues and things like that, life skills and just balancing a checkbook, reading a lease, interviewing for a job, having a place to stay when they leave. And we worked on that. Luckily, some money came up through a grant and Quality went after it. And recently we enacted that as Q360. But part of that whole thing is new mental health. And there's somebody here 24 hours a day for the inmates. And that's what I think that's what Stephanie's asking about. There's a lot more to it, but we're doing everything we can for them. yes, they're incarcerated, but yes, they're human beings. And at some point, like I tell the jailers when they start, the correction officers, at some point, these people are going to walk out on the street again. We have a captive audience, no pun intended. But this program we have, there's no incentive for a time cut. There's none of that. It's the inmates' choice whether they want to participate or not. And if they do, then we'll make room. And right now we have a waiting list, and I think it's wonderful.
If I can piggyback off that for just a moment, and this isn't particularly COVID related, but the sheriff has done a phenomenal job, along with Executive Director Huber at Community Corrections, in engaging folks that are in the system in programming and hooking up with social service agencies within the community. And one of the things that we've been talking to the sheriff about and to Executive Director Huber is getting them some additional space so that they can provide additional programming, do GED classes at those facilities so that they can, provide some mental health counseling, substance abuse counseling within those particular facilities. So we're really close to hopefully getting to a point where we can fund those additional spaces so those things can come to fruition.
And I guess to piggyback off Commissioner Murtaugh on that, I'm a firm believer in you can build more pods, you can build more cells.
Exactly.
And all you end up doing is warehousing human beings, and it doesn't work. It's failed forever. A lot of the push now is to programming, and I think I'm proud to say I think Tippecanoe County is out in front of this. There's other places that have been doing this these type of things, and they've been successful. But I think if we invest in the spacing issue to free up space so we can address these programs here and at community corrections, I think that's a better step than just building a 200 or 300 bed facility. Because I mean, honestly, we will fill it up. It'll be full, but then it just becomes a warehouse, and then that revolving door continues.
Exactly.
I think giving them the life skills that they need, working with them, getting them connected to the resources in the community. There's tons of them. And then transition that warm handoff that everybody speaks of. So, and I say this, but so their drug dealers not picking them up 100 feet from my office window, because we know that's what happens. But we're trying to work towards, we're doing it. We're setting up those meetings for when they're out, and we're going to drive them there. And if I have to drive them myself, I'll do it. I just don't want them coming back. It'd be great to have a 603 bed facility that's a bed and breakfast, because we don't have any inmates, because everybody's doing what they're supposed to do and getting the help they need.
I can't imagine vacationing at your jail, but
if it ever happens, Commissioner Murtaugh, we will give you a nice big room. But again, if anybody has any questions for me about here, please don't hesitate to ask. It's better to ask questions and educate yourself than try to guess or read something in the media. And that's not a knock on the media. I've had these conversations with them that are 45 minutes to an hour long, and unfortunately, they can only put 15 seconds on there.
Right.
So I tell everybody, please, I'm transparent. You want to know something, ask me, and I'll tell you. If I don't know the answer, I'll go find it.
Thank you very much. I hope people take advantage of that. I see any other questions coming through. Anybody have any other things they'd like to say or questions that we could bring up? I know that this is probably a pretty big subject. So do we have any other thoughts you'd like to share?
I'll add something. I know Tom had made a comment about how supportive United Way is in everything in the community, and they do provide so much support to our schools. And I mentioned the e-learning and the in-person options that Lafayette School Corporation is offering for those families who have have opted for e-learning for, again, various reasons, but most of them are health related, and they're valid health related issues. But these families might struggle with internet issues, whether they can't afford it, whether it's sometimes it's not a family who would be free and reduced, but a family who has opted for e-learning, whose parents work from home, who might have 4 to 5 kids who are home doing e-learning, and they just don't have the bandwidth that they need for everybody to be online during the day. And so through United Way, Lafayette School Corporation was able to write a grant and be rewarded a grant where we were able to buy 100 Wi-Fi hotspots, and not only the hotspots, but also pay the monthly fee for those hotspots. And we are able to distribute those to those families who might be struggling with internet issues. So that's just something else that I wanted United Way to be recognized for their support in helping our families who are doing e-learning.
Yeah, absolutely. That's really is a really great program for United Way. You know, there's another United Way program. Unfortunately, it's kind of a casualty of pandemic, and that is Read to Succeed. Of course, it's not going on now in the schools, and I was a Succeed volunteer. So it kind of bothered me. I wasn't able to get those kids anymore. I think there's been some discussion about how to continue that, but I don't think it's really moved forward beyond just the talking phase. But you know, this pandemic has affected the schools in a lot of different ways, and that's one thing I've really missed is going to Read to Succeed and being with the kids every week.
Absolutely, and our teachers and students miss it just as much as you do, Tom, if not more. And we certainly hope that we can get back to that. I know right now our superintendent, as far as I know, again, with the other school district as well, we're just limiting those visitors to our school just to be safe and precautious. And again, hopefully we'll get back to that, or if we can figure out a way to do Read to Succeed virtually, that would be great. And we would certainly work with United Way on that.
Yeah, thank you. Any other comments or thoughts from any of the panelists? If you have any questions, please put them in the comments, and we will ask the panel.
I guess while people type, if they're typing, one of the challenges we've faced is training. We have one job opening right now, but training has been nixed because everything's being canceled because of the pandemic. So we'll swear in 8 new officers October 30th, and Lieutenant Lowe and Sergeant Cree are trying to figure out a way to get them all in the academy. So that's one of the challenges we've faced. We have people that are hired and ready to go, but we can't send them anywhere to be trained to be out on the streets, protecting and serving the citizens of the county. So that's been challenging. And storage.
So is that because you have the kind of the hands-on training that has to be done? Are you unable to do that hands-on kind of training for those?
Yeah, and you may have several hundred people in your academy class, and when you're sitting in a room and you're literally right next to each other like a movie theater, it became very difficult for social distancing. The rest of the training that we've done here, we've made adjustments because there's some mandatory training we have to have. We've made adjustments and we've made it work.
Good. That's good.
Oh, looks like Ebony asked
I have a question for Dr. Clevenger. I'm sorry. We do have a question for Dr. Clevenger. Can you share some statistics regarding the meal distributions?
Right. We are very fortunate. Our free and reduced population now is about 67%, which is actually down a bit than we have been in years past. And we were just talking about this last week, actually. We think that part of that could be is that all our kids, regardless of their socioeconomic status, get free breakfast. And now we have received a federal waiver until the end of this calendar year, December 31st, where all our students get free and breakfast and lunch. So unless there's, like at Sunnyside, Tecumseh, and Jeff High School, there's an a la carte line where they can get some extra food items if they want, then they would have to pay for those. But what I'm going to call the packaged lunches, those are free for everybody. And just this week, we started sending home dinners or suppers with kids. So again, through federal funding and waivers and things of that nature, we're able to provide food for our kids. This is a hard time. A lot of our families have been furloughed or lost jobs, and kids can't learn if they're hungry. So providing lunch and breakfast and dinner, providing all these meals and snacks and things of that nature is really, really helping us out tremendously in our district.
Great. We also have another question. If the increased housing crisis has had effects on the county, the sheriff's office, or the schools?
I would
Any
say from
thoughts
the
about
sheriff's
that?
I'm aware of.
I'm sorry, Sheriff, what did you say?
I said for us as a sheriff's department on the housing crisis, not that I'm aware of. The only thing for us are the evictions that got put on hold. If that's part of what Stephanie's asking, those got put on hold and then they picked back up, and it's an unfortunate time. But we hope that they reach out to the services that are in the community.
And our health department is tasked with providing some shelter to folks who are either have been tested and waiting on results, or have been diagnosed with COVID that don't have any other shelter. So they typically will put them up in a hotel room, and they receive a grant to do that type of thing. And really hats off to our health department, because they have, of course, they've been affected more than any other government or any other department within county government. And they have really worked their tails off throughout this whole thing. I mean, this has truly uprooted their entire lives. A lot of things that they would normally do on a regular basis have had to take a back burner as they deal with these issues. But they have a lot of responsibility when it comes to the entire pandemic. They're still obviously reviewing every event. Over 500 people they have to review and sign off on that event, and the plan on how those events are going to be done with for the public safety. And they obviously are working very, very closely with restaurants and other businesses and entities like churches to make sure that what they're doing is compliant and in the best interest of the public safety. So I just want to give a huge thank you to the health department for the work that they've been doing.
Mm-hmm.
And I guess to go off of that, the health department, they've been incredible. I know I teased Kayla a little bit about being the reason football was canceled, but picking on her a little bit, but they have been outstanding. And another one that's kind of in the background that you don't hear much about is our emergency management.
Exactly.
They have been so helpful in getting PPE for us that it's been incredible, and helping us with billing and just making runs to Indianapolis. I mean, they've been great in the health department. Like Commissioner Murtaugh says, those folks, when this is all said and done, should have a 2-month, 3-month vacation wherever they want to go. They've been outstanding to work with, and they are absolutely exhausted.
And like Dr. Clevenger mentioned, just like a pot of money that was allocated for the schools, local governments received a pot of money from the CARES Act as well. And otherwise, we wouldn't be able to afford, all of the cost to make this. Really has been astronomical. And luckily, we have a pot of money in which we can use not only to provide PPE to keep our employees safe, but to do projects and to buy technology so that our employees can do things more efficiently and not have to do things face to face with citizens. And so without that kind of money, I'm not sure how any of us would have weathered this pandemic.
Certainly. We have another question for Sheriff Goldsmith. What are some barriers that are preventing more of those inmates from participating in purposeful incarceration?
Purposeful incarceration. I'm going to be upfront with you. That is not a term I've heard. I've never heard that term. So if Janice could elaborate on that, that would be great. And I guess while she types that out, there's another question that came in about where did it go? How did the procedure change for officers out on the streets on the shift? So what we did is we asked them to wear masks, and we did ask them on the traffic stops. That there's an interaction you can have there, but there's different ways of grabbing licenses and things like that, but really looking at, is this person driving 5 miles an hour over the speed limit and there's nobody around and you're stopping them to stop? Let's look at the seriousness of the offense. And really the calls for service, like I said earlier, if there's something we can take over the phone, we were taking those things over the phone, which it was kind of interesting in that our calls for service dropped immensely once everybody was staying home. I thought they would go up because people are in each other's face at home all the time, but they actually went down, which freed us up to do. If you've seen, we did all the birthday parades that we could for the kids in our jurisdiction. But yeah, really, it was still, if there was a call, we had to go on it. We asked them when they were on the call to stay socially distanced. If they went and somebody had COVID-like symptoms, to stay away, stay in their car, let us know if there was any change in their medical status. And fortunately, we've kept it out. And that gave Janice time to type regarding inmates participating in recovery programs in the jail. So unfortunately, those were some of the things that we had to cut out as far as bringing people in and meeting with inmates. And I don't like it. I'm just going to be upfront with you. I don't like having to cut those things out. It's something they need, but we had to control everything we could that was coming in here. We have a tablet program. I didn't mention that kicked off during this. So any of those things that those programs that they could do over a tablet through visiting or messages or anything like that, we asked them to use that. And from what I've been told by some of the inmates and some of the people participating, it's worked. Now, hopefully, once this goes away, we've got a project going on in the lobby, thanks to the commissioners, where we're going to be able to protect our people, and we've got it set up through the inmate phone provider where we should be able to open up visiting and then getting the QRT, those resources in the community back in here where they can do video visits. It's still difficult to allow people to go back in there because we don't know where they've been, and we got to protect the health of the inmates, and mental health is extremely important. It's extremely important, but right now we got to worry about the physical health. There's another question. Have you noticed an increase in domestic violence calls? No, compared to this time last year, they went down. I don't have the numbers again offhand, but they went down, which I'll be honest with you, again, it surprised me. But I don't know if that's people living in fear and they're afraid to call, if they just chose to stay in another area of the home, or if they just flat left, but they didn't call the police during those times that there was a domestic situation going on. But they went down, and honestly, it surprised me because you had people losing jobs, not being able to go to the doctor and anything like that. Just a lot of tension in the home and fear of the unknown, because there's still a lot of people that are afraid of this. So I can only imagine what the home life is.
So I think that question there is for all of us about services provided to our community by United Way. So if they reach, what effect would it have on the work you do?
Well, for me, it would be like a train crashing right into a wall. We absolutely have to have them. If they all packed up shop, we'd fail. I mean, we're all in this together, and we absolutely would fail.
I echo that sentiment that Sheriff Goldsmith said. The schools would be drastically negatively affected by that. We have so many of our kiddos and families that rely on United Way partners, YMCA, Transitional Housing, Mental Health America, Wabash Valley, or Valley Oaks now called. All of those United Way partners affect our kids and our families, and without United Way support, it would just be so difficult for those families and for us as a school corporation to support them without United Way support. So again, I thank United Way. Every single day I deal with a situation that without United Way support would be very, very difficult.
And I would echo that. I mean, just the fact that if we didn't have those United Way partners out there, a lot of that would fall on government, and certainly government cannot do it as well as our professional partners out there. They just do an amazing job, and it would obviously our community is very, very well served by our partners.
Yes, I would agree with all.
Oh, go ahead.
I cannot imagine not having the United Way agencies available for our community. Did you have something you'd like to add, Sheriff?
Yeah, going back to the inmates in the recovery programs, I guess I should have added, that's also a part of the new Q360 program. There's a mental health and addiction component to that. So although it's not the normal programs that are coming in, it's something that we didn't just cut cold turkey. We're still working on that. Is it perfect? I'm just going to tell you, absolutely not. If there was something perfect out there, we wouldn't be in the situation we're in. We're just trying to get better at what we're doing.
Hey, Sheriff, you mentioned your tablet program, and
yes,
that's a great program. Talk about how that helps with education and help.
Yes, there's another part. I guess we purchased, and I say we, and I'm just going to be upfront with you. The inmates, there's certain things on there they have to pay for. When they pay for those things, yes, we get a cut from that, and it goes into commissary. We use those funds that are generated from that, a portion of those, to pay for an educational package that within that package, they are able to work on things that help them prepare for the GED to pass that. So they're able to continue to do that. There's other things. What we're trying to do is get all the community partners to understand, if you have something, a program or something you want the inmates to be aware of, if you create a short video, we can add that and they can watch it for free. We control us and GTL, but we have a lot of say in what's free on that tablet.
And plus it helps occupy their time. Right?
Absolutely. I mean, and it's not a tablet. Some people think it's an iPad, and it's not. It's a very durable, strong tablet, but it's on its own network. So you're not getting out on the internet as you and I know it. There's a filter. I'm not a tech guy. I love gadgets, but I don't understand all that stuff. But yeah, there isn't a get on there and shop on Amazon and do things like that. They have access to movies, music, and things like that. And what we've noticed is those inmates that can't afford to play a movie or music, one that does have funds on their account will play that, and they'll sit down while they're playing cards, and they'll let everybody listen to music together. So it lowers tension, which is very important. If the inmates get upset, that bleeds over to my staff. And if the staff gets upset, they walk right through that door over there, and I get to hear about it. So it helps ease the tension. And again, it comes down to communicating with the inmates and telling them what's going on. And I've had them write letters to me, thanking me for coming, Captain Lehman and I, for going back there and talking with them. Even though they may not agree with it, they understand. So the inmates have been great through this. I mean, I really anticipated an uproar, and we didn't have that.
Great. Well, we have about a final 3 or 4 minutes here before we wrap up. Do you have any final comments from the panelists?
I just think, I think we're very lucky to live in Tippecanoe County where, like I've mentioned before, our 3 superintendents communicate and collaborate, and we're collaborating with, county government, state government, federal government, you name it. We're doing that. And I think if anything positive has come out of this COVID experience is that we have come together as a community and as a school district, and we'll persevere and get through all of this for sure. But it's going to be challenging, and there are challenges that I think we all face in our roles, but we're going to get through this one day at a time. And so again, thanks to United Way for all your support throughout this.
Yeah, I really agree that this has really highlighted how important the agencies under United Way and just all community resources out there, just how important they are. And actually, I think it illustrates that we probably need to support them even more. We need to expand what they do and make sure that they are equipped to respond to the needs of this community now more than ever.
Yes,
so maybe with that, we'll just wrap up on that note. So I want to thank all of you for your time in helping in this conversation. It's been a great conversation. It's been a great series. I encourage everyone to go back and watch those. Any that you have missed, I believe, are available through United Way on their website and on their YouTube channel. So I'd just like to thank everybody, and I hope you all have a good evening.
Thank you very much.
Thank you.